Hi, I'm Dr. Katie Woodley, the natural pet doctor. In this short video clip, we're going to go deep into what pet wellness truly means for your dogs and your cats. If you want the full video course, make sure you check out the link below for our pet wellness course, which is going to go through nutrition, vaccines, and all the different life stages of your dogs and cats and how to optimize their wellness. Please leave a comment in the comments below and make sure you subscribe so that you get access and updates whenever we upload new videos to our YouTube channel. Thank you. So what does being a senior pet mean? So like I mentioned, this can vary between dogs and cats, varies between breeds and their size. So typically though, around 7 years of age, we can call them senior pets. Cats are going to be a little bit older when we call them a senior because they can live into their 20s, same with small dogs, but typically that 7-year mark. So if your pets are at 7 years, they're a senior. If you have a giant breed, so like a Great Dane, like a Mastiff, one of those dogs that are really, really big, you might start thinking about some senior shifts around 5 to 6. So, because they don't unfortunately live as long as some of these other breeds. But remember, age is not a disease. So just like people, as we get older, I'm sure you've all seen videos of those older people that run marathons and they're 100. I'm like, wow, I can't even do that right now. I'm like 35. It's impressive. So age is not a disease. You can feel great. You can live a normal life as you get older, but we have to support the body. And remember, every animal is different. We are all individuals. And that's why I love natural or holistic medicine, because we treat each pet as an individual. It's all going to be different. Unfortunately, there's animals that pass away sooner, that pass away even as what we call a pediatric, so a puppy or a kitten. There's animals that get cancer at these stages. And unfortunately, there is some genetic component. There can be environment, there's nutrition. There's a lot of factors that go into this. You can do everything right, and your pet can still pass away from cancer. So we're going to talk a little bit about, some of these things that you might see in your own pets, or you might have friends or family that have dealt with this or are going through this currently. But the biggest thing is as a senior pet, they are more likely to develop diseases like osteoarthritis, degenerative diseases, behavior changes, and slowing down in general. So you are going to notice that their eyes look a little bit more gray. It doesn't mean that they have cataracts. We'll talk a little bit more about that. Their face is more white because their fur is turning gray. They tend to sleep a little bit longer. They can't go as far on their walks. So those are all important aging signs to recognize too. And a lot of those we can actually support and help them with, especially if they're feeling pain. There's a lot of things that we can do from a more natural perspective rather than giving a conventional drug that you might be worried about side effects. That's the beauty of what I do and how I can help pet owners. And then there's a lot of things that you can do that we can empower you with some of those tools today. Nutrition is very important. So we are what we eat. If you're eating cheeseburgers all day, you might turn into a cheeseburger. Just kidding. Well, you might actually. Your body's not going to like it. It might taste really good if you like that kind of thing. But eventually what's going to happen is it's going to catch up with you. So if we're feeding our pets really poor quality food, it will catch up with them. Unfortunately, they age a lot more quickly than we do as humans. And sometimes that can play a big factor in why they contract diseases, autoimmune diseases, cancer, things like that. So we want to limit the toxins in their environment also. This is a big factor, especially with increasing cancer rate we're seeing in our pet population right now. There's a lot of things we can do, and there's also a lot of things we can't do, and we have to be okay with that. But if we can control the things that we can control and be proactive, that's a huge step forward. And remember, that's all we can do. We can't control everything, even though we wish we could. And so this is going to interact with our pet's genes, which we can't control, but we can also interact. If anyone's heard of nutrigenomics, that's how nutrition will affect your genomes or your SNPs in your genes. So that's where we can use food as medicine, which is really neat. So what are some of the changes that happen with our senior pets? They tend to sleep more. I know my dog sleeps a lot more. They can get cognitive dysfunction. So you start wondering, does my pet have dementia? Do they know who I am? Why are they acting weird? Are they starting to have different sleep awake cycles too? You might notice that your dog or your cat is up all night and then sleeping all day. And that can be a sign of a cognitive dysfunction. And there's supplements that you can help them with to get their sleep patterns more regular, like melatonin is a really good one, just like it is in people. And so if you have a large breed dog, you can actually give them 2 to 3 milligrams of melatonin, make sure it has no xylitol in it before you go to bed. And we can kind of kickstart that normal cycle again. Definitely work with your veterinarian though, because if they are having behavior changes, that can be a sign that something else is going on. So especially if it's a drastic behavior change, like they're becoming really aggressive all of a sudden, that can be a sign of a brain tumor actually. So doesn't mean that if that's happening with your pet right now, doesn't mean that they have a brain tumor, but that's where you want to go into the veterinarian and get it checked out. Decreased vision and hearing, just like us. Sometimes as we get older, we get a little harder of hearing. So that's really important with those dogs that have lost hearing, but they can still see you. You can actually develop visual cues with them, use more food treats to develop those skills with them so they know what you want from them too. So that can be another way to further develop your relationship with your aging pet. You'll notice that their eyes become more gray usually. And what this is called is lenticular sclerosis. That is graying of the lens of the eye. It is not necessarily a cataract. So that's something that your veterinarian can look at and see, is this a cataract? Maybe there's something like diabetes that's developing that we want to look into with blood work. If your pet's drinking a lot of water, if there's changes in appetite, those can be all signs that there's actually an underlying problem. You'll notice that a lot of our pets become more white in the face. They get a little bit more gray. My German Shepherd is a true testament to that. If you look at him, he used to have a big black snout. Now he's my old gray boy, and that's okay. I still love him, but those can be signs of aging. They can be less engaged with us too. So they might go off to the corner, sleep somewhere else, not with us. Those would be signs that we want to make sure that they're not painful or that there's not something going on. When we have changes in behavior again, we do want to run blood work. If we need to take x-rays, those kinds of things, do an ultrasound, that's going to show us if there's something more going on. House soiling. This is a big one, and this can be a big reason why a lot of our senior pets are actually put down because they have bowel incontinence. So they're actually pooping inside the house, and they might actually be laying in it too. And if that's happening, it's okay if you're having to put your pet down because of this. Never feel guilty about that. Animals tend to be really clean creatures. And so if this is starting to happen, it's your pets telling you, hey, mom and dad, I've loved being with you. It's kind of time. So that's the one thing that we can gift to them at the end and help our pets keep their dignity. But especially with female dogs, urinary incontinence is a big one. And there's actually a lot of supplements that we can give our senior female dogs and male dogs that are herbs that act like the natural estrogen, because when we spay our pets, especially those females, what we're losing is the estrogen influence on that urinary sphincter muscle. So that's what helps hold that urine in. So it gets more and more relaxed as they get older, and then they end up leaking urine, and that can be a problem. There are a lot of conventional drugs that do help deal with that, but there are also a lot of things you can do: acupuncture, herbal therapy, supplements. So definitely talk to your veterinarian about what you can possibly do. If that's something you want to touch on more, send me a message. Let me know what your senior pet is dealing with so we can answer those questions in our Q&A and go more in depth with them. And then in terms of decreased activity, if you're noticing that they're having a really hard time getting up, moving around, you're noticing lameness, most dogs do not vocalize when they're in pain, or cats especially. Cats hardly ever vocalize. They're so stoic. And so if you are noticing these changes with their movement and their gait, that's a sign that they're painful. And we need to get them examined, see what's going on, make sure that it is truly osteoarthritis, it's inflammation, and then treat it accordingly. So, but also their joints, I mean, they're older. I know as I've gotten older, it's harder for me to work out, and I'm not even that old. And so I can imagine how my pets feel as they were walking. I can't take my dog on a 3-mile run anymore. If I did that, he'd be crippled the next day. So we go for shorter walks at his pace. And that's really important to remember, and try not to get frustrated with them, because we want to think about when I'm 100 years old, if someone had a leash around my neck and they're dragging me, how would I feel? So keep that in mind. And then if you're finding they're more grumpy, especially people who have children, if you're finding that your dog's getting more snippy or the cat's getting more hissy when your kid or yourself is touching your pet in certain areas, maybe around the hips or on the back, that could actually be a sign that there's something painful there. So keep an eye out for that as they get older. They usually play less with the other pets in the house. If your dog is like mine, though, he has no idea. His body is not the same as his mind, and he acts like a fool and wants to play like he used to, and his body doesn't realize it. So that's where we have to step in and say, no, no, no. Like, yes, we can play a little bit, but we have to play in a controlled manner. So those are really important things to watch for, and not let them overdo it, because they do not think through the consequences of their actions. And I've had pet owners that still run 10-year-old dogs like 10 miles a day. And I'm like, how's he doing after that? And they're like, oh, he's a bit more, he just sleeps. I'm like, okay, you might want to slow that down. So also increased anxiety. This can be a big thing. If you're noticing more separation anxiety, there can be imbalances going on. Maybe there's something going on inside their gut, their GI health is off, and we can look at that and we can support that. Anxiety can be fixed a lot of times when we fix the gastrointestinal health. And then the big one, sudden weight gain or weight loss. And this, as they get older, they do lose muscle mass. But if you're noticing like all of a sudden your pet is looking really gaunt, that's a problem. You need to take them in. There are a lot of different disease conditions that can cause that. And same with if they're suddenly gaining weight. So if they've gained like a pound in a week, that can be a sign that maybe there's a mass somewhere. Or for dogs especially, maybe their thyroid is low, hypothyroidism. There's really good treatments that we have available for that. And then there's also really good herbal therapies we can use to help support the body naturally. So what do all these changes mean? We've talked extensively about this as we were going through that list. There's normal aging changes, but you always need to bring your pet into the veterinarian for an examination, blood work. They might recommend ultrasound or x-rays, and that's okay. We need to have those diagnostics to figure out what we're dealing with, because we can say, oh, they're just getting older, this is normal, and then they actually have a tumor and we have not dealt with that. And then what happens is your pet gets really sick and can possibly pass away. So we don't want that to happen. So don't wait until they're really sick. If you're starting to notice some of these changes, definitely be proactive and get them in. There's a lot we can do. I am barely even touching what we can do. So, and remember, these changes can be a sign of pain. That's the number one thing we see as pets get older. So we want to make sure that our pets are free of pain. There's so many conventional drugs. There's so many foods that can help with inflammation. There's so many physical therapies, acupuncture, supplements, herbal therapy. There's ozone therapy. There's stem cell therapy. There's a ton of different modalities we can use to treat pain. So never think like, this is it. It is what it is. If he gets worse, I'll just put him down. There's a lot we can do, and there's a lot of supplements that you can use at home, and we can get you those doses. So definitely keep that in the back of your mind. For all of these disease processes, degeneration in general, aging in general, there's things we can do to support the body and keep your pet feeling really good. So that's the end of our senior pet discussion. Like I said, we have ebooks for each section of these modules that go more in depth, provide you with all the resources that we talked about. So definitely take advantage of those. And we'll have those listed at the end of this course. So make sure you're following me. We have a YouTube channel, we have a Facebook channel, The Natural Pet Doctor, and an Instagram channel, The Natural Pet Doctor. So super easy to find me. And then check out our website. Make sure you're subscribed so that you can get all our newsletters, you'll get special deals, If you want to work with me as a veterinarian and you're in the Northern Colorado area, definitely reach out. I do house calls. If you have a pet that needs help holistically through herbal medicine or wellness or nutritional plans, you can still reach out. I do phone consultations. So I love helping you help your pet, empowering pet owners, providing hope again so that our pets can feel healthy and thrive naturally for as long as possible. So I'm Dr. Katie Woodley. This is the Natural Pet Doctor. Stay tuned for our next module.